Back outside because my son owns me. Little thing. So, when did I start to feel that my first surgery was not successful? That's a good place to start. So, the first surgery, they decided just to take the bone, just a little piece of bone. Looked like I had flow, looked like things had worked perfectly. The surgery went well, got back to work. Around the 3 to 4 month mark is where my symptoms just snowballed. Like, my numbness extended more to my left hand. My legs were starting to go numb more. Pretty much when I slept, everything went numb. The numbness was starting to kind of trickle into the day too, where the more I did, the more numb my left hand would go, the more numb my feet would go. The more I sat, I would go numb. My headaches were, I would say, getting worse, which is, oh my God, worse really. So I do what I do best, it was in denial. I kind of knew that the surgery didn't work around that time, but I just, I was hoping that it was just, it takes a long time for that flow to be reestablished and for you to heal. I just thought maybe it's just a setback. But then at the 6-month MRI, that's when they saw that there was no improvement with my syrinx, that the flow was not reestablished, and that my first surgery did not work. So this was 6 months after, of course. So I then had the information that I would have to have a second surgery. So two brain surgeries within a year. This is just at the year point of diagnosis. No, actually symptoms, not even diagnosis. So that crushed me. It was hard. It was like, why didn't he take more bone? But if this is a fellow Chiari, we all know that if you take too much bone, and I have an underlying connective tissue disorder, which is a whole different subject, that could be detrimental to my stability and my flow and everything. So I did first blame a little bit my neurosurgeon, thinking, why didn't he just do more when he got in? But now that I look back, he did exactly everything that he needed to do, and it wasn't his fault that it looked like the flow was established. So I did decide to stick with the same neurosurgeon because I'm in Wisconsin and there's no other specialist except for Chicago, and he's not accepting adult patients. Fun fact. So I went in and I asked my neurosurgeon about all the questions and all my reservations for a second surgery. I asked him if the second surgery would be done differently if I had a connective tissue disorder, and he assured me he would do the same for somebody who had an EDS type of connective tissue disorder, which I suspect maybe I might have some type, but not like the real bendy type, if that makes sense. So he answered all my questions very well. He wanted to fix it. He just said, I want to fix it. That's what I do, is I fix it. And he kind of sweet talked me into the second surgery with him because of lack of options, and because he did a really good job on the first one, except it didn't work. But technically speaking, there was no complications with the first surgery, and things went well. So my second surgery was scheduled for, I thought I'd keep it consistent, May 22nd of 2018. And this time he was going to go in and he was going to remove as much as he possibly could to keep the structure of my spine sound. And that's what I was facing. Worsening symptoms. Dizziness, vertigo, a lot of those got worse too, which I suspect I have something called POTS too, which is a posterior orthostatic tachycardia syndrome, where anytime I climb stairs or stand up, my heart rate kind of goes up into the 130s to 150s, so that makes life interesting too. Anyway, we'll come to that during more of the second surgery type thing. So pretty much desperate, wanting to get fixed, feeling a little hopeless at that point, but hoping that the second surgery was going to do the trick. So stay tuned.